Ask the patient to stand and close their eyes. The elbow should be fully extended and arms at a 90-degree angle. Then ask the patient to touch their nose with their index finger, one hand at a time. Remain close at hand in case the patient begins to sway or fall. Ask the patient to position one foot in front of the other in a straight line marked on the ground. Patient then should walk down the line heel to toe and then turn around at 180 degrees and walk back the same way. Make sure to stay close behind the patient for safety. Ask the patient to remove their shoes and keep their eyes closed. Patient will first stand on a firm surface. In phase 1, the patient will perform a double leg stance. Phase 2 is the single leg stance. Ask the patient to raise one foot with dominant foot remaining on ground. Phase 3 is the tandem stance. Patient will perform a tandem leg stance with dominant foot out in front. Each stance should be held for 20 seconds. The same phases are applied to the soft surface stance, but performed on a cushioned surface. Use the scoring system to see if this patient tests positive or negative. A unilaterally dilated pupil can be indicative of neurotrauma if more than 1 millimeter difference in diameter and not equal in the pupil's response to light, or if the pupil does not react appropriately to light. For example, if a pupil remains the same diameter or increases in size when a light stimulus is applied. Complete the test with both eyes uncovered and then each eye covered. Stand in front of the patient, ask them to follow your finger with their eyes while keeping their head in one position. Trace an imaginary H and a star shape in front of them, making sure that your finger moves far enough out and up and down so that you are able to see all appropriate eye movements. Isolated lesions of a cranial nerve or the muscle itself can adversely affect extraocular movement and or point to cranial nerve damage. Have the patient smile big and stick out their tongue. For this next one, just have the patient shrug their shoulders. For this test, you'll want to speak to the patient and test for hearing, and then have the patient speak back to you. A hit to the head can sometimes be associated with a more serious brain injury. Use the Glasgow Coma Scale with a patient score of less than 15 to test a patient that may be suffering from a coma.